Chapter 7, Subjective Truth, a chapter about measles. Mom, I don't feel very well. My throat hurts. Oh, you're probably fine. You have that test today. If you feel worse after that, I'll come pick you up. Evelyn Harding also had an important day at work that she couldn't afford to miss, at least the first part of the day. She heard her daughter coughing at the table and looked up. Jamie hadn't touched her food. She looked a little peaked, but no worse than the usual cold. Come on, dear, we're going to be late. Bring your breakfast. You can eat in the car. Evelyn grabbed her coffee and work bag and headed for the door. Welcome back, Jamie, greeted Mrs. Jefferson. How is Europe? Find any time to study for... Hey, are you feeling okay? Jamie knew she had to somehow avoid getting sent to the nurse's office, at least not until after her math test. Her mom had told her to try to hang in there until at least 10:30, and she could come get her then. I'm just tired. I think I caught a cold on the plane home. But yeah, Europe was amazing. Jamie plopped down at her desk near the front of the class just as her best friend Allison came in. I don't know how Allison does it, Jamie thought, coming to school with a bandana covering her bald head. I think I'd opt for a wig. I'd go blonde, long blonde, no, red. But Allison likes to keep it real. Oh my God, Jamie, how is Europe? I can't even imagine, bubbled Allison, heading for the desk next to Jamie. Tell me everything. Wait until lunch, girl. We have a math test to kill. And actually, I'm not feeling very well. You might want to stay clear of me today. Oh, that's fine. I'm not due for my next chemo cycle for another couple weeks, and right now my white counts are up, so a little cold won't matter. But you know, Jamie, I appreciate you watching out for me. The bell rung and the girls got to work. Mrs. Jefferson looked at Jamie as the kids shuffled out at the end of the class. Now her eyes were red and she looked flushed, and that cough had started to get a little distracting. Jamie, dear, I think you should go see the nurse. Okay, Mrs. Jefferson, Jamie managed, glad that she'd made it past 10:30. Oh dear, yes, you definitely have a fever. Would you like me to call your mom for you? That's okay, Miss Ramirez. I already texted her. She's on her way. Samantha Ramirez washed her hands and pulled Jamie Harding's record up on her computer. She was required to check the immunization status of every student who came through sick. This seemed like a flu, but yes, sure enough, Jamie had had her flu shot this year. Everything else was up to date too, so nothing to worry about. Dr. Tommaso liked his new office. Although the space was much smaller, it better suited his low-key style of practice. And since it didn't need to accommodate a dozen other pediatricians, nurse practitioners, medical assistants, office managers, front office clerks, and 6 patients an hour per doctor, it didn't need to be large. These last few months had brought a much welcomed change to his professional life, and he was happy to be comfortably busy as virtually all of his patients and a number of his partner's patients followed him here. He had enough office space to bring on another doctor and figured he'd have to do that soon if things got any busier. Hello, Jamie, greeted Peter as he walked into the next exam room for his first sick patient of the day. Looks like you have some flu symptoms. We just got back from Europe, explained Mrs. Harding. I picked her up early from school, took one look at her, and came right over. She seems way more sick than usual. It's just a sore throat and mild cough, Mom. Peter smiled at the unspoken eye roll that his patient managed to suppress. And fever, and now your eyes are red too. Dr. Tommaso, what do you think? Peter had begun looking at Jamie, feeling her neck glands, looking in her ears, listening to her lungs, and finally ending with, say, ah. Her throat looks a little strange. Light reddish spots. Not really red enough to be strep. No pus. It could be just a flu, although we haven't really seen much of that quite yet. Could be another virus. It could possibly be strep, but I don't think it is. I'll have Heather run a rapid strep test just to rule it out. Basically, I don't think it's anything that's going to need antibiotics unless it does show strep. It should clear up within a few days. Peter moved on to his next patient, an 11-day-old who was in for his first checkup. Those pink spots in Jamie's throat. Where have I seen those before? He wondered. He washed his hands extra well before examining the next baby, whose cuteness quickly made Peter forget all about it. Another busy day in the office, sighed Peter as he looked at his schedule a few days later. I guess it's good to be busy when you are self-employed. But he often felt more tired now compared to when he'd first started doing this a few decades ago. And I can't complain about the slower pace now. 3 checkups an hour is really nice. Heather, his new medical assistant, walked up to Peter's desk. Mrs. Harding is on the line. Her 11-year-old woke up with a strange rash this morning, and she's really worried. Peter remembered seeing Jamie a few days ago. Maybe it's a strep rash, scarlet fever. He pulled up her chart just to make sure. Strep test was negative. Maybe the test missed it, though. It isn't a perfect test. Tell her to message us some pictures and I'll look at them. An hour later, Peter checked his inbox of messages on his laptop and saw the message from Mrs. Harding. He clicked on the pictures and instantly felt a sinking feeling in the pit of his stomach. Damn, that's what those spots in the throat were. He leaned back in his chair so he could catch Heather's attention over at her workstation. Heather, call Mrs. Harding. Tell her to bring Jamie back in, but have them drive up and just wait outside by our back door. I'll see her outside, and tell her not to stop anywhere along the way. Peter checked Jamie's immunization status. Yes, she'd had her MMR vaccine when she was 1 year old. 1 dose usually gives immunity to about 95% of kids, so Peter didn't usually push his patients to get the 2nd dose at age 5. But those pictures do look just like the measles rash. And yes, now I remember what those pink spots on her throat and inside cheeks were. Koplik spots. Stupid, stupid Peter. Should have recognized those. Peter had a hard time focusing on his next few patients and couldn't wait to see Jamie so he could, hopefully, decide it wasn't measles. But he had a sinking feeling that it was. Yes, it's measles all right, Peter said to himself as he looked at Jamie in the small parking area beside. Yes, it's measles all right, Peter said to himself as he looked at Jamie in the small parking area behind his office. She looks pretty good, though. According to Mrs. Harding, Jamie was coughing less and feeling slightly better, but still had a fever. But that rash is very obvious. Started on the face and neck, then moved down the body, scattered red bumps and splotches, as Mom put it, but has now coalesced into darker red patches. Plus, there's the recent travel to Europe. Well, it looks like measles, Mrs. Harding. I know Jamie did have the MMR vaccine, but it's not 100% effective. She probably caught measles in Europe. Is she going to be okay? I heard measles is deadly. Mrs. Harding looked very concerned, and Jamie suddenly looked scared. No, Mrs. Harding, Jamie, you have nothing to worry about. Although measles can be serious, fatalities are extremely rare, about 1 in 10,000 cases. There can be some complications, but mostly just ear infections and diarrhea or dehydration. Occasionally pneumonia, but these are easily handled, especially in a country like ours. And Jamie looks fine. She has a very routine case. She'll have to stay home for another few days, 4 days from the onset of the rash. Just give her lots of fluids and some healthy foods. Oh, and vitamin A drops. High-dose vitamin A is recommended for hospitalized patients with measles complications, but I like to give it to any patient who has measles. Not that I've seen that many. Just that one family, 8 years ago? But Jamie still looked very concerned. When do you think I started being contagious, Dr. Peter? She asked. About 4 days before the rash started, so that would be probably the day before you came to see me. Oh, good, said Jamie's mom. That means you weren't contagious on the flight home. Yeah, but I was contagious at school that day. Sure, I've been at home ever since. But, Mom, the math test. And oh my God, Mom, Allison. Peter saw the concerned look on Mrs. Harding's face. Who's Allison? He asked. She is Jamie's best friend, and she has leukemia. Well, she had leukemia. She's kind of in the recovery phase. Still on chemo, though. But can't something like measles be very bad for someone like her? That depends on a lot of factors. It depends if she is currently immunocompromised. But listen, we are getting ahead of ourselves. We don't know for sure yet that this is measles. We first need to confirm the diagnosis, and I'd suggest you go to the public health department for testing. They will give us faster results, so we'll know what to do and what this means for your friend. I'll call the health department right now to confirm they can see you, and I'll come back out here to let you know. Wait, the public health department? Mrs. Harding grabbed Peter's arm, and he inwardly flinched. Stop that, Peter, he told himself. They don't have leprosy. Mrs. Harding would actually have to be sick to pass it, and it doesn't just pass through a casual touch like that anyway. Why do we have to involve them? Are they going to investigate us? The house is a mess. We haven't even fully unpacked yet. I heard they like to take your kids away if they get really sick with something and it was your fault. Okay, Mrs. Harding, listen. First, this wasn't your fault. You vaccinated her. But even if you had chosen to not vaccinate, you still couldn't be found at fault simply for choosing a more natural approach to raising your child. No one takes your kids away for that. And yes, I would like to involve them so they can help us prevent an outbreak. In fact, legally, I have to call them. We all need to work together on this. I'll be right back. Peter knew he was in for a long day. No, a long week. Before calling the health department, and after washing his hands and his arm, he couldn't help it. He checked his schedule from when Jamie was in 3 days ago. Damn, that newborn baby was here, and a host of other kids. Many probably unvaccinated, since that is the majority of my patients these days. If this is measles, there are going to be a lot of scared parents and angry health department authorities. Stop that, Peter. Don't you go getting all conspiracy here. The health department is here to help, and you know you are legally obligated to involve them. So buckle down and do your job. Peter picked up the phone. Mom, Jamie says she thinks she has measles. Mrs. Harrington didn't hear her daughter at first. She was trying to find a parking spot in the medical center's outpatient lot, and, as usual, the place was full. What did you say, dear? I said, Jamie just texted me that she thinks she has measles. Hold on. Allison tapped away on her phone some more. Wait, did you say measles? Sally Harrington said, her daughter's statement finally registering. Ah, there's a spot, right near the entrance to the clinic, she thought triumphantly. With their life such a nightmare this past year, it was the little things that helped keep her going. Oh, that's terrible. Is she okay? What do you mean she thinks she has it? I said hold on. She's sending more info now. She and her mom are on their way to the public health department to get tested. She's been sick all week. She didn't look good on Monday when I saw her for the math test. She said she had a cold. Geez, Jamie, we are lucky that your white counts are up right now. Otherwise, I think measles could be really bad for you. Plus, you were vaccinated for it anyway, and your doctor already told us we wouldn't have to worry about measles or chickenpox, even when your counts are down. It would be things you were not vaccinated against that we have to worry about. We'll double check with the doctor, though. You aren't due for chemo again for another 10 days, but we might have to postpone it. Let's go. We're late. Peter got to the office early the next morning. The county health department lab had called last night and let him know about the positive result. He'd expected it, but it was still a bummer. He read up on what would be expected of him and his office as far as notifying any exposed patients who were in the office when Jamie Harding was there and for about an hour afterwards. He identified about 14 potentially exposed patients during those couple hours. Some had been there for checkups before Jamie, but hadn't left yet before Jamie got there. A few had just come in the front office area to ask questions. Then several had come through the office in the next hour during his busy sick time. That's the challenge with measles, he reflected. You think you just have a cold, but that's the most contagious period. It spreads through the air from coughing. By the time you realize you have measles, as evidenced by the rash, you've exposed a lot of people, and it passes easily through the air. He knew he was immune. He had both his and his medical assistant's vaccine records on file, and they'd both had 2 doses of the vaccine. He also had a titer checked a few years ago because he was curious to know everything he was immune to before his trip to Africa. And he was very immune then. He was glad his wife/office manager wasn't there that day. She was probably immune too, though. Out of his 14 exposed patients, 6 were unvaccinated, including a 6-year-old who had been in the room right after Jamie had left. 6 were vaccinated. One new patient's vaccine status was unknown, but the one that worried him the most was that newborn baby. He was too young to have been vaccinated. He had spoken with the parents that day about starting vaccines at 2 months, and they told him they were planning to vaccinate, but weren't going to get every vaccine, just the more important ones. Heather was already calling the unvaccinated families to come in so they could get all their questions answered. Peter didn't want to spend an hour on the phone with each family listening to them panic. Not that he didn't care, but he just didn't have all day to spend on the phone. He'd counsel them all as a group at lunch, outside the office. He knew none of them could get sick for about 7 days from exposure, and some may not feel sick for up to 21 days, but he'd keep them outside. Half of them probably don't want to step foot into the office right now anyway. Peter knew it was too late for anyone who was not vaccinated to go ahead and get the vaccine now. It had to be given within 72 hours of exposure in order to try to prevent the disease from taking hold. That's the other thing about measles. By the time you know someone has it, more than 3 days have usually passed, so unvaccinated exposures can't benefit from the vaccine. Then again, they chose not to vaccinate, so they knew the risks. The key now is to keep all of the unvaccinated exposed people at home during the 7 to 21 day post-exposure period. You don't wait for them to feel sick. You just ride it out at home, starting maybe on day 5, and the public health department will make sure they comply. He was going to have his staff call the vaccinated patients next, just to let them know. They will be assumed to be immune if they've had both doses of the MMR, or just 1 dose but not yet old enough for the 2nd dose at 5 years of age. He planned to offer them all high doses of vitamin A anyway, as he was going to offer it to the unvaccinated families at lunch. I'm glad I keep a good supply of it in the office, high doses of the liquid drops once a day for 2 days, and he give it free of charge. It wasn't worth charging the few dollars it cost him to buy it. He knew vitamin A reduced the risk of severe complications, according to the World Health Organization and the American Academy of Pediatrics. That's why they give it every year in many poor countries. It's literally an immunization against severe measles. What research wasn't positive on was whether or not the vitamin helped prevent the disease itself. But that's okay. Reducing complications is useful, although severe complications are already rare. But Peter wanted to talk with the parents of the newborn baby himself. He dialed their number. "Hello, Mrs. Jelinski. This is Dr. Peter Tomaso, the pediatrician." He always found it more instantly recognizable for people when he reminded them which Dr. Tomaso was calling. "How is the baby doing?" "Oh, the baby's fine. These newborns always are. Seriously, Why doesn't anyone ever ask how the mama is doing? The laugh in her voice told Peter she was kidding around. Mostly. I know. These first weeks are the hardest part of the already hardest job in the world, or so I'm told. That got a sleepy-sounding laugh from the other end of the line. Anyway, the reason for my call is Peter went on to explain the exposure and the preventive treatment that is recommended for young babies and immunocompromised people who have been exposed to measles. Measles immune globulin. This is an antibody shot that neutralizes any live measles virus in the system. It's very different from a vaccine, which stimulates the body's own immune system to attack the measles. The immune globulin instead is actual live anti-measles antibodies filtered out from donated blood units and processed for injection in situations just like this. I appreciate you calling, Dr. Peter, Dr. Tommaso. It's Dr. Peter to my patients. I appreciate it. I know quite a bit about vaccines and diseases after reading up on this whole controversy while waiting for the baby to come. And you know what makes me the most angry? I, this baby's mom, am supposed to be immune by going through the natural infection when I was a child. But I was vaccinated along with everyone else, and the vaccine wears off. So most of us adults aren't immune to measles anymore. And we don't pass vaccine-induced measles immunity to our babies so that they can be born immune. If I had caught natural measles as a child, when it's mostly harmless, I'd be immune now, and I'd have passed all my wonderful antibodies to the baby, and we wouldn't even be having this conversation. Wow, Mrs. Jelinski, I'm impressed. Very few people would even know that. You are right. In the old days, all kids caught measles, and rubella too, and all women grew up immune so they'd be immune through pregnancy and pass about a year's worth of very effective immunity to their babies. Then that immunity wore off. The kids caught the disease themselves when they were safe, and the cycle continued. So ironically, it's the vaccine's fault that my baby was exposed to measles. Again, another laugh. It's more the fault, or fault isn't really the right word. It's more of a change in mindset in a modern country like ours and how we decide to approach the normal childhood diseases. Our medical policymakers decided we would be better off eliminating these from our population. But the drawbacks? We lost natural herd immunity. And the artificial induced herd immunity we opted for doesn't work nearly as well. And these live virus vaccines don't work in young babies. So now a lot of babies are susceptible to these diseases, as are most adults. It was a trade-off. Peter briefly explained his take on artificial versus natural herd immunity, although he suspected this mom already knew all of that. He concluded, I think there are good arguments on both sides, especially when you factor in that we know getting all the childhood diseases during childhood provides some significant benefits against allergic disorders, asthma, autoimmune disease, and even some cancers. Our immune systems were designed to be challenged during childhood to give us better protection from a lot more than just the diseases as we age. But again, fatalities from diseases are a tough pill to swallow for any modern society. But are we causing more long-term health problems in everybody by depriving them of these diseases just to save a few lives? Challenged Mrs. Jelinski. Well, those deaths are immediate and tragic. The long-term health consequences of not catching these diseases aren't immediately apparent to people, although they have a huge impact on society as a whole. Cost of healthcare, quality of living, etc. Anyway, wow, that was quite a digression. Back to the point. I do recommend the baby get the immune globulin shot. The window in which it's effective is within 6 days of exposure, and it's been 4 days. The theory is that the antibodies will neutralize any measles that got into the baby before the infection takes hold. The public health department can deliver the dose to us today, free of charge. They keep a supply handy, and the government pays for it because it's very expensive. Damn right they should. It's their fault my baby isn't immune. Okay, Dr. Peter, I'll let it go. But it was nice to be able to vent. I'll bring the baby in at the end of the day. Wow, thought Peter, that was interesting. She's one of the smartest moms I've met lately. We've got measles. We've got measles. Jim rolled his eyes at the phone. He should have let it go to voicemail. He could picture Tony jumping up and down at his desk down the hallway, and Jim prayed that none of Tony's female co-workers were currently sitting near enough to hear Tony's not-so-subtle 80s movie quote. Not that he expected any of them to get the reference, despite the fact that many of the women in that department were nerds too. It was definitely a guy's movie. But if or when any of them did, the HR department would have their hands full with sexual harassment charges. Nice. Where? Washington State again, near where that one Hib case occurred a while back. So far, all we have is that it's an 11-year-old girl with recent travel to Europe. Vaccinated too, although we haven't confirmed that with records yet. Well, hopefully there'll be more to the story, Jim said, bored again. People aren't biting on just regular measles outbreaks anymore, since we have about a dozen or so small outbreaks every year, and each of them are so quickly contained. No one dies. Francine is worried that the public is going to realize we really aren't in any danger from measles and what that might do to the vaccine rates. I'm thinking I'm going to call my stock guy anyway. Get me some more shares. The value always goes up at least a blip, even with normal outbreaks. You sure you don't want in on that? Yeah, I'm sure, Tony. I'm just not really a stock market guy. I enjoy other perks of the job. I'll at least put out some local media alerts on this, but we won't go national until we have something more, like an exposed baby or the mother lode, a kid with cancer. Jim almost said, but one can only hope, right? But he caught himself. Geez, have I been working for Francine for too long? Dr. Tommaso, that's the 5th call we've gotten from the media today. They really want to talk to you. Sorry, Heather, you'll just have to keep telling them that our patient care is confidential and that the public health department should be able to answer their questions. And I wonder how the hell they even know, wondered Peter. He wasn't surprised that the media knew about the case, just that they'd found out so quickly. And once it hits the news tonight, we'll be flooded with patient calls tomorrow. And if some patient dares to page me tonight after the news broadcast in a panic because their child happens to live in the same county as this measles case, I'm going to. Now, Peter, you know you won't tell them how you really feel about their ignorance and buying into the fear-mongering the media like to stir up. You'll be patient with them, like you always are. Yeah, but I still won't like it. I'm going to post the What to Do in Case of a Measles Outbreak flyer on our homepage and put in a request on our voicemail for patients to first read that before calling us. That should help with the patient calls tomorrow, and by then, the media will probably have moved on once they learn there's no story here. Peter was a smart guy, if a little naive. Jim? Yes, Tony, I roll. Guess what? What, Tony? Ah, come on, guess. Tony never played guessing games before, Jim realized. That meant, wait, are you messing with me? Someone who matters was exposed? What, cancer? A baby too young to be immunized? What? Yes. Yes, which? Wait, you mean both? Yup. No way. Francie, Mrs. Donahue is going to be happy. I mean, this will give her, us, some more angles to work with. No one died, I hope. No. And this is straight from the local public health department after their first day of tracking down all the known exposures. And it's all preliminary. Nothing's been confirmed yet. And, oh, by the way, you can call her Francie when you're talking to me, you know. You two aren't fooling anybody. Anyway, here's what I know. Francine held up her hand for quiet in the room, and the team quickly settled down. Okay, so we have about 17 exposed in the doctor's office, 6 unvaccinated, 1 newborn baby, so we pushed those 2 angles as usual, and another 50 or so exposed at school, with 3 of them unvaccinated. But we also have an exposed preteen with leukemia. According to what we could manage to see in her electronic medical records, she isn't currently immunocompromised. In fact, her oncologist isn't even giving her immune globulin because she's had both her MMR doses. So don't share any details with the media besides the fact that patient Zero's best friend, who is suffering from leukemia, is working closely with her oncologist to make sure she survives the exposure. And of course, the usual, measles is preventable with vaccination. Make sure your child has had 2 doses of the MMR vaccine, which has been proven to be the best, safe, and effective protection against measles. Measles is on the rise, Disneyland outbreak, unvaccinated kids, vaccines save lives, etc. You know the drill. Do we know if the prevention department is going to be talking about vitamin A this time? The question came from near the back of the room. They are not, as usual. We want to focus on getting people immunized, and the vitamin A prevention protocol detracts from that. In fact, they are putting out a press release reminding the public about the dangers of overdosing on vitamin A. Since it's a fat-soluble vitamin, people can overdose on it and cause harm. Sure, they can't cause harm with just the 2-day measles dosing protocol, but we don't want to confuse anybody. Oh wait, I almost forgot. We've got to spread the all-important word out to adults as well. Adults can catch measles, and it's way more serious when they do. They should talk to their doctors about updating their MMR vaccine, especially if they live in a county with a measles epidemic. I spoke with the manufacturer this afternoon, and they have a nice stockpile ready to ship out wherever needed. So make sure your media contacts focus on that as well. Adult vaccination is the new black. I know it's late, but it shouldn't take more than an hour to get this out to your national sources in time for the 11 o'clock news. Check in with me before you leave to go home. I'll be in my office. 90 minutes later, Jim followed Francie out to her car. It had been a long evening, and he was seriously tired. But he saw the spring in Francie's step and knew that she was the opposite of tired. In fact, she was glowing. What exactly is it about these outbreaks that gets her so excited, he wondered. Is it the simple satisfaction of a job well done, of saving lives? But none of my doctor friends get excited over disease outbreaks. They actually hate them. He saw her pull out her car keys and click the car unlocked as they approached. He tried to decide if she wanted him to drive home so she could relax, or Francie opened one of the rear doors of her car, set her briefcase down on the ground, turned around and grabbed Jim by the shoulders, pushed him into the back seat, and climbed in after him. I might be getting too old for this, he wondered briefly, before deciding he didn't care. We are live in front of the Harrington home where little Allison is fighting for her life after being exposed to measles several days ago. What makes this deadly disease especially dangerous for this young teen is that she also suffers from leukemia and is currently undergoing chemotherapy. With her system possibly immunocompromised, measles is expected to be even more dangerous for her than it already is. We've also been told that, fortunately, Allison did receive all her vaccines when she was younger, including both doses of her MMR vaccine, and that this safe and effective vaccine could end up being particularly life-saving for this young woman. We won't know if Allison is out of the woods for 3 more weeks, which, according to the Centers for Disease Control, is what is called the incubation period for this disease. The family has so far declined to comment on their only daughter's condition, but we will keep you updated in the weeks to come. Meanwhile, ask your doctor if your children are up to date on all their vaccines, and adults can get a booster dose of the MMR vaccine to make sure their measles immunity is up to date as well. Measles spreads easily. Even being in the same store or shopping mall with someone who's contagious can put you at risk. This is Sarah Sanderson, reporting live for News Channel 17. Sarah had gotten the call just in time to get out to the subject's home for a live shot and commentary for the late-night news. She wasn't happy about canceling her evening plans, but a job was a job. They were the only station here tonight, a fact that she owed to her connection back east. but she knew the place would be swamped in the morning, both here and wherever the baby lives. Sarah had chosen to go with the immunocompromised angle tonight and leave the new baby angle for Bob on the morning crew, who hadn't been able to get over to the baby's house in time for tonight. Oh well, you snooze, you lose. We'll open with both angles again in the morning, she knew, and spend as much time on it as we can, because the public really needs to know when these things go around so they can decide whether or not they should stay at home, too. What do you think, Tommy? You want to stay parked here tonight so we have a front row seat in the morning? She asked her cameraman. Yeah, I probably should. Steve will chew us out if we give up the spot. Why don't I call you a lift, and you can stay in that inn we passed a couple miles back? No reason why we both should get a bad night's sleep in the news van. Plus, you are the one who needs to look pretty and all. Peter clicked off the news, ready for bed after the long day. His wife patted his hand. About what you'd expect, she consoled. Do you know the immunocompromised child? No, she's not my patient, although the Hardings mentioned Jamie's best friend was in remission from leukemia. That means she should be fine. I'll ask the Hardings when I see them, but it's amazing how cleverly that reporter summarized all the right points to scare people. Only the intelligent would see through it, and there aren't enough of those in the audience to matter. Let's go to bed, although I doubt I'll be able to sleep. Paula Jelinski decided this would be the morning to resume her routine walk. Gotta get back in shape. The baby seemed fine after getting the measles antibody injection yesterday at the doctor's office. Dr. Peter seemed so apologetic, but she knew it wasn't his fault. She knew it was nearly impossible to recognize measles before the rash, but any doctor worthy of his profession would still feel bad, which means she'd picked the right doctor. And I better take the baby outside while I still can, she realized. The day 6 quarantine would start tomorrow. Even though she and the baby technically should be able to just walk around the block without infecting anybody, especially without even having symptoms, she decided she'd play by the rules and not risk it. The health department might be watching. Oh, stop that, Paula. You're being paranoid. Baby in stroller, running shoes on, or rather, very slow walking shoes on, she opened the door and stepped out to a street full of news vans and reporters. What's going on? She looked up and down the street for some sign of commotion. Police cars, fire engines, something that would explain why. She froze. All the cameras were pointing at her, and multiple voices erupted in unison. Mrs. Jelinski, is your baby okay? Mrs. Jelinski, do you have a few minutes to answer some questions? Mrs. Jelinski, how old is your baby, and has he started his vaccines yet? Pardon the interruption, Mrs. Jelinski. It's Bob Stephenson from Channel 17, said the closest reporter. We understand your baby was exposed to measles. How is he doing? Is he okay? How are you holding up? He is a she, thank you very much, she thought to herself as she ducked back inside and closed the door behind her. Well, at least that last guy was polite about being rude and intrusive. How the hell did they even know? Then she started laughing. Of course they would know. And of course they'd try to make a spectacle of it, scare the public, stir up the mob. There'll be torches and pitchforks by tonight because of my unvaccinated baby. Never mind that she wouldn't even get an MMR vaccine until she was 1 year old, and the only shot she's missed so far is her newborn hepatitis B. Maybe I should go back out there and let them know how it's their own fault that my baby doesn't have measles immunity. Let the public know that there's a trade-off to vaccinating, and maybe getting every single vaccine isn't always a good idea. No, her smarter half restrained her. There's no easy way to explain something so complicated to a camera, and they just edit it to make me look crazy anyway. But she could still hear some of the commentary through her open window. Well, Steve, I was unable to confirm the status of baby Jelinski. It would appear that he is alive, although I cannot confirm just how well he is doing. We will keep the News 17 audience updated as events unfold here at the Jelinski residence. Back to you, Steve. Taking a few deep breaths, Paula wheeled her baby into the family room in the back of the house where they kept the elliptical machine. So much for a nice morning walk outside in the fresh air. At least I can still get in some walking. And look on the bright side, I can catch up on Grey's Anatomy while I get this body back into shape. 4 weeks later, Peter and his wife were relaxing at a resort in the Bahamas for a very well-deserved vacation, 4 of the toughest weeks he'd had in a while. But it had all gone smoothly, he summarized to himself, sipping his rum punch and watching his wife nap next to him in her pool lounge floaty. Napping during the day must be nice. His patient, Jamie, was just fine, although the several phone calls he'd gotten from Mrs. Harding that week about the high fevers and the body aches left him with the impression that it was anything but easy on Jamie. Fortunately, no one in her family had gotten sick. Her friend with leukemia in remission was fine too. 2 unvaccinated kids from Jamie's school had come down with measles, but they were already in quarantine when symptoms started. A fully vaccinated child and the school nurse had also come down with it, but the nurse had started a self-imposed quarantine on day 6 and so hadn't gotten anyone else sick. The vaccinated child exposed the kids in Jamie's class a second time, but had only been at school that first day of having runny nose and cough before her mom pulled her out, so the health department wasn't concerned as everyone in the class was likely immune. They'd still be vigilant for another couple weeks just to be safe, but all in all, just a routine measles outbreak, as they almost all were. And he still couldn't believe none of his patients caught it from that morning of exposure in his office. The newborn was fine. The 6 unvaccinated kids were released from home quarantine after 21 days, and none of them had gotten sick. They'd all come in for vitamin A dosing, and he wondered if that was why. And none of his fully or partially vaccinated patients had caught it either. Either measles isn't as universally contagious as they say it is, or vitamin A really does help prevent it, or we just got lucky. I should publish these data. Yeah, as if. I'd probably only get it picked up by Joe's Granola Journal of Science or some such publication. No mainstream medical journal is going to publish a case series of vaccinated and unvaccinated children exposed to measles in a doctor's office in which none of the kids caught the disease. They'll accuse me of making it all up. The medical community really plays up on how contagious measles is. Ever since one person caught measles from being exposed to a contagious person sitting on the opposite side of a stadium in the mid-90s, everyone says you will catch it by simply breathing the same air that an infectious person breathed even an hour before. Well, not in my office they didn't, but the media had been another story. The epidemic had received national attention. The plight of the poor girl with leukemia on death's door, the fragile newborn baby cooped up in her home, the fear of measles continuing to spread nationwide, the media lies that reminded us that measles had been eliminated in 2000, a year that had had 85 reported cases in the U.S., the lies that measles has a 30% complication rate and a 20% hospitalization rate, even though that's not even close to true, and the complete and total silence about the other way people can help prevent measles complications. Nope, the vaccine is the only thing you can do, should do, and you are a bad parent if you don't do. Then there were the bloggers and tabloid writers, casting blame on a doctor for daring to accept unvaccinated patients into his office, conveniently forgetting the fact that patient 0 was vaccinated, as if it was my fault that a patient would choose to not vaccinate against one thing and then they catch that disease. Like, I didn't do my job well enough if a patient left her appointment with me failing to convince her to vaccinate her kids. If doctors start getting blamed for their patients' illnesses, people are going to stop becoming doctors. A doctor's job is to provide informed consent, educate the patients, share their opinions about treatment options, urge patients to accept treatments, and ultimately respect a patient's right to choose. The ethics are very clear on that. And I'm sure virtually all Americans would agree. But when it comes to vaccines, the vocal minority and the very vocal media look at things differently. The only right choice is to vaccinate. The real truth about measles, as Peter saw it, was that it really was a routine illness for virtually every child who caught it in a modern country like the United States. The real fatality rate was about 1 in 10,000. Peter knew that the 1 in 500 or the 1 in 1,000 fatality rate, often quoted in the media, was misleading. Those numbers were the fatality rate in reported cases, not in all cases, and they came from the last large outbreak in the United States from 1989 to 1991. During that outbreak, thousands of cases had shown up at hospitals and doctors' offices, and out of those, about 1 in 500 to 1 in 1,000 died. But that's really just out of all the people who felt sick enough from the measles to seek medical care. Decades earlier, back when everyone caught measles, research showed that only about 10% of people felt sick enough to seek medical care. When measles became a mandatory reported disease, the data showed that only about 10% of cases were being reported, even though every child was catching it. Bottom line was that about 90% of people who catch measles don't feel sick enough to seek care. So all the stats on fatalities and complications are overblown because they are only based on people who feel the most sick. And when the media warn that measles has a 30% complication rate, they don't tell you that statistic comes from only the reported cases as well, not from all cases. The true complication rate out of all cases is only about 3%. Plus, most of those complications are simply diarrhea and ear infection. The serious complications are extremely rare, and it's not on the rise. The 600 cases a few years ago was an anomaly due to the single large outbreak among the Amish in Ohio. You take out that year, and it's been steady for the past 20 years, but that doesn't stir up fear. Then there's vitamin A. Almost every third world country uses it as an immunization against measles complications. Some even give it as a yearly dose to all kids. That's because measles is very dangerous to anyone who is vitamin A deficient or malnourished, but that's not America. Yet the media and the medical community are unwilling to push that angle. Why? Because no one makes any money from vitamin A. The only solution is the vaccine. Why not publicize both? That way you reduce the disease spread and reduce complications for those who do catch it. Vitamin A for measles isn't granola medicine. The research is extensive and clear on that. The Disneyland outbreak really gave the powers that be the ammunition they needed to make vaccines mandatory for school in California, he reflected. Even though not a single case of measles was transmitted in any school during that outbreak, and over half of the cases were in adults, they still managed to pass a law to make vaccines mandatory for the one place that measles didn't happen. The irony frustrated Peter, and he was very thankful that he'd been able to keep the tiny outbreak at the local school from spreading. Otherwise, his state might be facing the same new law. The media had, thankfully, stopped calling his office. He'd called one of them back once, thinking they wanted him to come into the studio for a live interview. But, as it turned out, all they wanted was any information over the phone that they could get to use against him. He realized that they were too scared to let him appear live on the news. No one has doctors like me on TV anymore. Ever since Dr. Ward tore Dr. Smith a new one on what ended up being a live debate about aluminum, filmed by a number of people in the audience on their phones and posted online, very few mainstream shows want to talk about this live on TV anymore. They want control. They want to do prepared pieces that they can frame to forward their agenda. Maybe that means we are finally getting under their skin, but it also means it's getting harder to reach the mainstream public who aren't investigating these issues themselves. Wow, that was a ramble. What even got that started? Oh yeah, measles. I'll just have to keep on keeping on. Tell the truth. That's all I can do. Like in that movie, Concussion. Will Smith just kept asking people to tell the truth, and they eventually did. One can only hope. But I'm tired. I can't do this forever. I know I'm not the only doctor who thinks this way and who gives long talks to his patients about vaccines. I still need to figure out a way to make such talks available to everybody. Objective, neutral, science-based talks that help people make an educated decision. If I could just clone myself, like Arnold Schwarzenegger in that movie, that didn't turn out well for him. Although, an idea planted itself in Peter's mind. Not actual cloning, of course, but along the same lines. What if... Stop that, Peter. It's vacation. You can worry about saving the world when you get back to it. Geez, my glass is empty. I'll just paddle over to the pool bar for another and be back here before my wife wakes up. And then... It sure was nice to finally vacation without the kids. Dr. Rosen was also reflecting on the last few weeks, but for a different reason. She was a rheumatologist. Joint aches and pains were her specialty, and the elderly population in this Washington state community was keeping her busy enough. But this past week, her office had gotten a couple dozen calls from young adult women complaining of sudden onset of severe joint pain and swelling. She'd seen a few of these already, and each one had looked like rheumatoid arthritis. Lab tests were still pending, but she knew RA when she saw it. So what the heck is going on? You can't have epidemics of an autoimmune disease unless there's some sort of environmental factor, like a toxin or something. She was aware of the small measles outbreak at one of the local schools, and she also knew measles could be a trigger for RA, but so far none of the 3 new women she'd seen had any symptoms of measles, and none of them had even been exposed. She'd added a measles IgM and IgG titer to their blood work out of curiosity, but she didn't expect to find that they'd caught subclinical measles. Wait, I wonder if any of them went and got the vaccine. I can't believe I didn't even ask. I'll have to follow up on that with some phone calls tomorrow. But surely no one would have been dumb enough to give adults the MMR vaccine unless there was a confirmed exposure and they weren't immune from their childhood vaccines. Because the MMR is risky in adults. That's why we don't give MMR boosters to most adults. Even the CDC warns right on their vaccine warning statements, a 1 in 4 risk of suffering an arthritis reaction, some of which will become severe and chronic, meaning RA. But they don't spell that out on their warning sheets because that would scare people. But every rheumatologist knows this. The problem is, family practice docs and internists don't. They just give whatever vaccines they are told to give. And I bet they've been giving it out left and right during this outbreak, without informing their patients of the risk. Sure, get the MMR vaccine if it's important. I agree with vaccination. But with adults, it's trickier and often riskier, especially when giving a live virus vaccine that was supposed to have been a childhood disease. The disease and the vaccine are both more dangerous for adults. That's why we safely use these in kids only. I'm going to ask Sarah if she'll do a news report on this, warn people to consider the risk of adult MMR vaccine before they get it. She likes to do medical pieces. RA sucks. It means drugs for life, and a life that's less fun to boot. I'd take measles over the MMR vaccine as an adult any day, and I'm a doctor.